We are back on Taking Care of Business on Koerner Radio, News Talk 1180, and our guest by phone is Sally Pipes, president of the Pacific Research Institute. And Sally, again, this is about the third time we've been lucky to have you on, and we're going to run out of time again because there's just so much to this topic to talk about.
So, Sally, go ahead.
I was going to say, I'd like to describe understanding healthcare as it's like unraveling an onion, many layers and many tearful moments. We could spend days talking about this because it's so complicated, and I like to be able to put it in some sort of language that people understand, what the Patient Protection and Affordable Care Act is going to mean for their health and their health care.
Mm-hmm. Before Clay asks you a couple more questions, I just want to push your book a little bit because it's an excellent book. The new book is called The Pipes Plan, The Top 10 Ways to Dismantle and Replace Obamacare. It's a great little book. Clay and I have a copy here, and it's fantastic. I highly recommend it.
The best way to do it is in one shot, just to repeal it.
Yes.
But yes, and then replace.
Yeah. Here's the question: is there anything good about this bill?
In my mind, there absolutely is not. I mean, as I've said before, the key goal is affordable, accessible, quality care for all Americans. The Obamacare is not going to result in affordable care because this care is going to become more expensive. It's not going to be accessible. People will still be uninsured, and it's not going to be high quality. We're all going to have the quality of care we get go down. If you look at the employer mandate, which is part of Obamacare, remember the president said over and over again, if you like your health insurance and you like your doctor, nothing will change.
He lied.
And the average premium will go down $2,500. Well, the Congressional Budget Office has said the average premium will go up by $2,100. And, already employers are making changes in the way that they provide health insurance. Last year, the average family premium was $15,000. 60% of Americans have their health insurance through their employer, which in my mind is the problem itself because the government got us into that mess when wage and price controls were in. But, we are going to see a lot of employers will say, we would rather pay that $2,000 per employee fine rather than paying $15,000 so employees can go out and buy their insurance in these exchanges. And they're going to find that if they like their doctor and they like their health insurance plan, things are changing. And so, it's very, very discouraging what the employer mandate means, the individual mandate, for us as Americans.
I'm already looking and speaking with some of my employers in regard to dropping their health care coverage and just taking the $2,000 penalty, which I think is going to make a lot of sense for a lot of employers if this bill continues. But there's also another penalty of $3,000, I understand, if one of your employees goes into the exchange.
Right, exactly. And the first 30 employees, the employer mandate kicks in for any employer with 50 or more employees, and the first 30 are exempt. But you're going to see, we need to have job growth in this country. It's one of the key goals of keeping this country going is job growth. Well, why would anyone start a new business? Why would anyone hire, expand their number of employees beyond 50 because of the pressure of Obamacare? So this is really negative for expanding our economy, reducing unemployment. The president keeps saying he's about jobs and about increasing employment. Well, this legislation is moving both of those things in the wrong direction.
What about one of the positives that I've heard from a lot of people is that you can cover a child until they're 26. I guess my question is, when does the child become an adult?
Well, exactly. Back in September of last year, remember when the president gave 58 speeches on health care, he started out by talking about health care reform, but he quickly, in August of 2009, moved to the idea of health insurance reform. He and Nancy Pelosi see the health insurers as the villains in this whole business. And, so there were a number of controls that came into effect last year. Some are being phased in. But one was that children will be able to stay on their parents' plans till the age of 26. Now, I don't know about you two, but I certainly never considered myself a child at 23, 24, 25. There are about 2.5 million children have joined their parents' plans. Of course, this is pushing the cost of health care up, and I'd like to look at how many of those 2.5 million kids were people who dropped the insurance they had to join their parents' plans. But this is pushing the cost of care up. We're also going to see this year, 2012, that the annual limit or lifetime cap is raised to $1.25 million. By 2014, insurers are not going to be able to have any annual limit or lifetime cap. And in 2014, there will be no discrimination based on pre-existing or chronic conditions. And of course, last year, free preventive care. But of course, you can go to the doctor and have these tests, but have these checkups. But when you have to have a procedure done, it's not free. You have to pay for it. And I think people are saying, "Oh, I thought if I had a colonoscopy and they found I had something and had some polyps removed, that would be free," and that's not the case.
Not
Crazy.
at all.
Our guest by phone, author of the Pipes Plan, president of the Pacific Research Institute, Sally Pipes.
So some of the things we've talked about today: guaranteed issue, pre-existing conditions being covered, community rates, restrict coverage and services, we're eliminating choice, we're adding additional taxation, and we have a life and death committee. These are the things that are in Obamacare, and these are the things that are going to destroy health care in this country.
Yes, you're absolutely right, and that's why in my book, The Pipes Plan, The Top 10 Ways to Dismantle and Replace Obamacare, is such an important read. It's written in a style that the man on the street, can understand, because, people need to realize, and I think, when people think about the post office or K-12 public education, they realize government does not solve the problems. We have, entitlement programs such as Medicare, Medicaid, and Social Security the costs are skyrocketing out of control. We need to have changes to Medicare and Medicaid. We were talking earlier, Medicare came into being in 1965 when the average lifespan was age 65. The Medicare trustees have now said, with the average lifespan moving from 65 up to 79.5, tremendous pressure on Medicare, and it will be bankrupt by 2025. And of course, Nancy Pelosi says, well, if you start doing any means testing, raising that eligibility age, doing premium support or vouchers, seniors will be dying in the streets. Well, if this plan goes bankrupt, a lot of people will be dying in the streets. It's so important that this become, that the cost of Medicare and Medicaid be reduced through Medicaid in particular, with block grants to the states. Let the states decide how they want to run their program for low incomes, not the federal government having tremendous control.
Incredible. Yeah, I totally agree. The other thing about your book, though, Sally, that I really liked is you have a chapter for each one of the 10 ways to dismantle and replace Obamacare. I mean, it's very well laid out. It's a great read for anybody who really wants to know about this travesty that's being placed on the American people.
The problem is most people don't want to take the time to read it. And what employees want low premiums until they have a claim. Then they want maximum benefit.
Right, exactly. And so, but we have to change the way the American people think, because as I said, government got us into this mess in the first place during World War II when wage and price controls were in. Most people, the 60% of Americans, about 160 million, who have employer-based coverage, they have what we call first dollar coverage. They have and they might pay a small part of the premium, they might pay a small copay, but they have no idea what the real cost is of health care. And so when people think something is inexpensive or it's free, they demand and use a lot more of it. So we need to put doctors and patients in charge, not the federal government with all of these mandates and controls.
Well, I can't believe it, Sally. Between you and Clay today, I've just learned that the government actually has lied to us about this. I'm just stunned.
Yeah,
right,
really.
Exactly. Yes. Well, the president, as I say, gave 58 speeches on health care reform. He wanted to be the first president in 75 years to get health care reform done. He did, and the American people don't like it, and that's why we don't want to keep moving down the line with more and more government control. We want to repeal it and replace it with a health care plan that will bring us affordable, accessible, quality care, and that comes from the issues that are in my book and the things that we just talked about today.
He played 90 rounds of golf and I don't know how many basketball games, has taken several vacations, doesn't even go together. He and his wife take separate planes. He has no interest in saving money for this country. Well,
Sally, one thing that I hope with all his basketball that he doesn't hurt himself, because if he has to subject himself to Obamacare, he may not get the care he needs.
They have a different plan in the government.
This is true.
Yes, exactly, yes. Yes.
Sally, thank you so much for the time. We have to have you back in a couple months when this issue gets to the forefront again.
The Supreme Court and Sally.
Yes.
Thank you so much. Take care.
Have a great day, Sally.
Yep, bye.
We'll see you in 167 hours on Taking Care of Business on Koerner Radio, News Talk, 1180.